Hi, my name is Andrew Kirk, and this is my first oral presentation for senior seminar, Meloxicam administration either prior to or after parturition, effects on behavior, health, and production in dairy cows is the article that I decided to review. This article was published in November of 2018. It has a site score of 5.4 and an impact factor of 3.333. This article was published in the Journal of Dairy Science in November of 2018. The primary author is T.W. Swartz. There were several supporting authors: Schramm, Bewley, Wood, Leslie, and Peterson-Wolf. The affiliated institutions with the study were Virginia Tech Department of Dairy Science, Virginia Maryland College of Veterinary Medicine, Cow-Focused Housing, Virginia Tech Department of Animal and Poultry Sciences, University of Guelph Department of Population Medicine. Financial contributions to the study were made by Virginia Tech College of Agriculture and Life Sciences Graduate Research Assistantship. To fully understand the summary of this study, there are a few terms that you will need to be familiar with. Eutosia is normal labor or birthing. Dystocia is abnormal or difficult labor. And NSAID is nonsteroidal anti-inflammatory drug. During calving, there are increased rates of disease, injury, and mortality. This has often been linked to an uncontrolled inflammatory response. NSAIDs are used to combat the inflammation. However, the only NSAID that is labeled for cattle by the United States FDA is flunixin meglumine. If you have experience with large animals, you've probably heard that referred to as banamine. There are many European countries, and Canada has also approved Meloxicam, which is another NSAID for use in cattle. There have been studies examining Meloxicam usage after calving, and it has had favorable results. The objective of this particular study was to compare the results of administering Meloxicam prior to or after calving and test the effects that it had on behavior, health, and production in dairy cows. The hypothesis of the study was that administering Meloxicam prior to calving would increase activity and also increase milk yield compared to giving Meloxicam after calving, and that dystocic cows would be more responsive to treatment than eutocic cows. 237 dairy cows were recruited for this study. About 3 weeks prior to their calving date, the test subjects were transported to a common facility where they received uniform diet and housing. There were 3 test groups: Meloxicam pre, Meloxicam post, and Meloxicam control. In the Meloxicam pre group, Meloxicam was administered prior to calving and a placebo was given after. In Meloxicam post, Meloxicam was administered after calving with a placebo given before. In the Meloxicam control group, a placebo was administered before and after calving with no Meloxicam administered. Vaginal thermometers were also placed in each test subject about 14 days prior to their calving date. This was used to detect the temperature drop that is indicative of labor, usually within about 48 hours of the temperature dropping they would calve. Accelerometers were also fitted to each of the animals. This was used to measure activity, the lying time, and the lying bouts, so how often they were laying down, and once they were laying down, how long they remained there. Herd health was also monitored by 2 university veterinarians. The milk was weighed by an automated milk meter, and the contents of the milk were analyzed by NIR. In eutocic cows, there were no differences in the treatment groups, so whether they received Meloxicam or not did not affect their activity levels. However, in dystocic cows, the ones that received Meloxicam pre or post calving were less active than in the control group that did not receive any Meloxicam at all. Their disease results, there was no effect in increase or decrease of disease incidence in any of the treatment groups. Concerning milk yield in eutocic cows, the cows that received Meloxicam prior to calving produced higher daily milk yields. However, there were no differences in milk yield in dystocic cows of any of the treatment groups. The milk quality results showed that cows that received Meloxicam prior to calving produced higher levels of fat, protein, and lactose in the milk than either the Meloxicam post or Meloxicam control groups, so they just had a better overall quality of milk. The studies show that administering Meloxicam prior to calving increased the daily milk yield and the overall quality of the milk when compared to giving Meloxicam after calving or not administering the drug at all. The findings of the study oppose the hypothesis. The control group actually exhibited higher activity levels in dystocic cows. The article stated that this is possibly due to the cows receiving Meloxicam being more relaxed and being able to rest more than the control group, thus the decreased activity level. The study observed that dystocic cows had fewer lying bouts, but the cows stayed down longer, likely due to inflammation. The summarized conclusion of the study was that Meloxicam prior to calving is beneficial in cows with a normal labor and birthing, but more studies would be needed to determine if Meloxicam has adverse effects on dystocic cows. This journal article can be described as a credible resource. It passed the CRAP test, so it is current, relevant to my studies, published by a reliable source, presents accurate information, and serves the purpose of educating veterinary professionals. The study presents a moderate sample size sufficient to be considered credible. It also had a site score of 5.4 and an impact factor of 3.333, which confirms the credibility of the article. The title is not exaggerated and no bias is suspected. The study is also affiliated with the College of Veterinary Medicine, and it is part of a larger renowned journal which adds to its reliability. There are no obvious characteristics of the article that have been deemed untrustworthy.